The COVID-19 pandemic has upended our world, putting hospitals and healthcare workers on the front lines of a constantly evolving crisis whose impact will extend well into the future. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter for AHA. Exacerbated by the COVID-19 pandemic, healthcare organizations are facing many challenges related to recruiting, training, retaining, and managing a qualified and engaged workforce. What are the latest forces and trends affecting healthcare human resources talent management strategies? Today we hear the perspectives of Elisa Arespacochaga, Vice President of the American Hospital Association's Physician Alliance, and two other prominent AHA leaders. These experts' viewpoints are among those included in the 2021 Healthcare Talent Scan, the AHA's annual snapshot of healthcare talent management trends and strategies. The 2021 Healthcare Talent Scan is sponsored by Certify Screening.
Good day, I'm Elisa Arespacochaga, and I'm pleased to have with me today two of my colleagues, Joy Lewis, AHA's Vice President of Strategic Policy Planning, and Jeremy Sadler, Director of HR Initiatives for the American Society for Healthcare Human Resources Administration. So I'm glad to share with you that the viewpoints of all three of us are included in the 2021 Healthcare Talent Scan, the AHA's annual snapshot of healthcare employment. We're here today to discuss some of those. Jeremy, I'm going to start with you. From your perspective, what are some of the top challenges or drivers of change in healthcare workforce management? And then as a follow-up, how do you suggest hospitals and health systems really get their arms around that and start to address it?
Thank you for giving me an opportunity to answer this question. I think the main change coming to the workforce in healthcare is what we all sort of know is on the horizon, which is the fact that we've got an aging workforce coupled with an aging population. So we've got the need for additional healthcare providers to be infused into the system, despite the fact that we are losing more current healthcare providers than we are gaining. So with an aging nurse population in particular, with 50% of our nurses across the country beyond the age of 50, we really need an influx of new clinicians, particularly new nurses, into our workforce. The unfortunate reality is what has typically and historically been the expectation for clinicians and healthcare providers is not necessarily what millennials and Gen Z are really looking for. Healthcare has historically been, site-based. It hasn't been the most flexible of career paths. It tends to have restrictive time off policies. And what millennials and Gen Z are really looking for: flexibility, work-life balance, the opportunity to be gone on weekends and on holidays with their family. And much of that is very difficult in the healthcare environment. Another thing that is affecting our workforce management is the fact that we have seen reductions in reimbursement. And the unfortunate reality is, with reductions in reimbursement, organizations have to make decisions on where to spend their workforce dollars, and have fewer and fewer opportunities to grow clinicians from within their ranks as the ancillary and secondary positions within healthcare have slowly moved out of the hospital environment and the healthcare environment, due to cost and lack of reimbursement and due to efficiencies. So what has historically been our farm team for our workforce, meaning those entry-level workers that find their niche in healthcare and choose to go back to school and take advantage of tuition reimbursement. Unfortunately, there are fewer and fewer of those folks to then fill the clinical roles that we will need long term.
So, Jeremy, given all of those challenges, what are some of the ways that hospitals and health systems can address it?
Well, that's a great question. I think the best way to address it is really threefold. First and foremost, you need to become the preferred employer in your marketplace. You do that by ensuring that your clinicians and your caregivers have a voice. You have to make sure that your policies and practices as a healthcare as a healthcare provider or as a healthcare system are 21st century workforce policies. And what that means is you have to have flexibility and creativity with how you staff and how you hold folks accountable. So becoming that preferred employer is incredibly important. You have to be able to grow your own. So I talked a little bit a moment ago about how it's more difficult when you have fewer and fewer ancillary staff to grow. But you need to do that through partnership with educational institutions. You have to create and encourage career ladders. And you have to make sure that your educational programs and your tuition assistance programs meet the employees' needs, but also your future workforce needs. And don't forget about retention. We understand that we've got an aging workforce, but having an opportunity to keep some of those folks employed in less physically demanding roles is incredibly important. And then making sure that we continue to grow our non-clinical and clinical talent, giving them the ability to lead and have an influence on the direction of the organization is incredibly important and will help you retain employees long term.
Thanks, Jeremy. Now, Joy, I know you spend a lot of time thinking about some of the longer term impacts and horizons related to workforce. What do you see the long-term impact of COVID-19 being on the staffing needs for hospitals and health systems?
That's an excellent question, Elisa. I'm happy to weigh in here. I'm sure you've heard the saying, never let a good crisis go to waste, a phrase that was popularized by Raheem Emanuel, former mayor of Chicago and President Obama's first chief of staff. Although I'm told that phrase actually may predate him. But my larger point being that as hospital and health system leaders plan for staffing needs in a post-COVID world, there really is an opportunity to design for that future state that incorporates improvements in care delivery by effectively re-envisioning how care should be rendered and how care should be experienced by consumers. And so at the end of the day, each staff role will need to be assessed for its purpose and relevance moving forward. Because prior to the pandemic, home health aides and nursing assistants and other entry-level positions were projected to have the greatest supply gaps through 2025. But now we're in an environment where, for example, we've seen this rapid ramp up in the use of telemedicine, and advocates are now calling on the Centers for Medicare and Medicaid Services, CMS, to make permanent many of the telehealth provisions that were relaxed to support virtual care during the pandemic. So if and in fact, this does materialize, I've actually heard some of our hospital and health system leaders say that by leveraging technology, that will result in a reduced need for some frontline low-wage workers, such as call center workers, schedulers, and nursing assistants who would, typically room patients. So if instead we're anticipating a pivot to an increased use of online platforms for scheduling appointments, for example, or a digital triage method for office visits, we may very well end up in a place where healthcare in all settings may learn to manage with less staff as revenue is reduced and the use of technology increases. So some would argue that that's clearly good for driving efficiencies in our healthcare system, and others would say it's not so good for workers, right? So wanted to really hone in on that point. But if I may, one key learning from the pandemic is really the need for our hospitals and health systems to better prepare for sudden shifts in population health needs. And I don't mean to suggest that we were caught flat-footed, because we weren't. We're always there and our doors are always open and we're ready to serve our communities. But one trend that has emerged as an effective strategy to respond to increased staffing needs in COVID-19 positive units was this idea of cross-training, right? And so looking ahead, I think we will see this become much more routine, where some staff will be cross-trained to ensure versatile skill sets, which frankly, during the COVID-19 surge, it was perceived as a good thing by many staff members who welcomed the opportunity to learn something new. So I'd just say that the field has been innovative in adapting to the urgency of the situation, and I anticipate that we will continue to innovate well into the future.
Thanks for bringing that up, Joy. And I think one of the things that we also saw as some of those teams were being built, and I don't know that people anticipated this as much as it happened, but the insulating effects of those teams and that community on resilience and well-being, helping to support those groups. So I think it's those are two lessons that we've really learned. Jeremy, I want to pick up on the telemedicine piece specifically, and looking more at some of the day-to-day ramifications today for the clinical workforce and for different service areas such as behavioral health, addressing substance use disorder. How do you see telemedicine weaving into some of these activities, and what will that mean for that workforce?
Well, thank you for that. There's definitely an opportunity for the industry to pivot, and we've seen other industries have to pivot related to COVID, whether it's restaurants that need to deliver or curbside pickup at stores. And the fact that a number of people are working from home and doing meetings by Zoom. So everybody in the entire world right now is pivoting a little bit. So we can certainly expect that healthcare is going to have to pivot as well. I think the greatest impact on telemedicine will be in the rural and underserved populations. It is often difficult to find specialists and subspecialists and behavioral health professionals that are willing and interested, and frankly have a large enough population to sustain their practices when you move into a rural area, or you move into an area that doesn't necessarily is historically underserved and may not have the volume of patients in a particular geographic location to justify a permanent home, if you would. So I think ultimately you will see, and we are already seeing, the fact that telemedicine is changing the game. I think it's something that the industry has hoped for, meaning that CMS would take some of the regulation out of telemedicine and give us a better opportunity to serve populations that have historically been underserved. I think it will be really good for patients and providers, particularly in the mental health space. I think there's a lot of opportunity to have interventions prior to crisis if telemedicine were available. It will reduce ED visits for those mental health visits that are missed, or folks that have and feel a stigma related to a mental health crisis or a mental health illness, and then mistreatment or choose not to have treatment. The ability to do that in a telemedicine location, or in the future doing it from home through a telemedicine visit, may help us with the fact that people are being treated prior to crisis. I think there are a number of workforce implications as well. And some of those are positive and some of those are negative. I think initially organizations are going to have to understand that there's a cost to the technology, and there may be some front end cost that needs to be picked up by healthcare providers to make sure that they are able to treat in this way. I think a lot of healthcare providers were already doing that. They were already making those investments with the hope that that telemedicine would take off and that some of the restrictions in getting paid would be removed. And I think, if there's a blessing to COVID-19, I think some of those restrictions being removed has, maybe one of those blessings. I think there are opportunities for new technical roles that will create brand new positions in the healthcare industry that we haven't thought of yet, and that we may not think of, even for a couple of years to come. But there will be new roles in healthcare that are specific to telemedicine that that will change the way we treat patients and what we do on a daily basis. I think there will be greater efficiency in the healthcare system, and I think ultimately that the move to telemedicine will change everybody's life in some way. And if you really think about the way healthcare's changed in the last decade or two, there has been a huge shift from inpatient to outpatient treatment. And what we're now seeing is a shift from outpatient treatment to telemedicine. And the way that ultimately affects our clinicians is when you move from more care being done inpatient to more care being done outpatient, the acuity of that inpatient goes up. And I likely suspect that what we will see as we move from outpatient to telemedicine is that in some ways the acuity of the outpatient will go up, and what is the routine visit will become a telemedicine visit, and the more significant outpatient visit will be the norm. It'll have a higher acuity. I think the whole world of care is shifting, and it's shifting, and it has shifted in years past from inpatient to outpatient, and now it's shifting from outpatient to telemedicine. And as we shifted from inpatient to outpatient, what we saw was higher acuity on the inpatient because much of what was being done inpatient based in the past was being done outpatient based now. And I think we will see the same shift in acuity from outpatient to telemedicine. What is the routine outpatient visit now? Some of those will become telemedicine visits, leaving only the more acute, more significant outpatient visit being done in person.
I agree, Jeremy. I think there's going to be a significant shift. Joy, as we think about some of these new jobs that Jeremy mentioned, and the greater use of AI, of data analytics in shaping how we deliver care, combined with the opportunity, if you can call it that COVID has given us to question our assumptions about care delivery. What do you see as some of the skills or positions that might be in high demand, say in 5 years out, 10 years out?
So I have to break it to you, Elisa. The future is human and machines as coworkers. And I am not a futurist, but I think this is becoming more and more apparent to many of us. Artificial intelligence is a profound way to augment clinical workflows and reduce the reliance on us humans for routine, mundane, basic tasks, right? And so AI really has the potential to free up our providers for higher order thinking and the ability to make real-time assessments to guide providers in their clinical decision making. And so in my mind, there will be a whole new cadre of workers to help build and implement the data analytical frameworks and to produce those skill sets that specialize in things like computer science and statistics and engineering. I think all of these will be front and center. In fact, recently I read an article that called out several examples of position titles that will emerge. And so I'll share some of them with our listeners, some of the more interesting ones. So there is a title called research engineer. There's an algorithm engineer, machine learning engineer, data scientist, data architect. And this one I thought was really interesting, measure experts. And a measure expert is someone who structures data in a way that aligns with quality and patient safety indicators. And so, I think we can all agree that care will be experienced and rendered in new ways. And I hinted at this earlier when I talked about this desired future state, right? One in which the healthcare workforce delivers human-centered care, digitally enabled, or what some refer to as connected care, team-based care. I think all of these approaches will accelerate across all healthcare settings. And so, as we've seen technology unleashed in the past 6 months, and as we begin to make greater use of artificial intelligence and data analytics to inform and shape treatment decisions, new skills will be in high demand. And I have no doubt that we will continue to deliver location agnostic care and leverage AI and other technologies to augment care.
Well, the future sounds bright indeed. Thanks for that, Joy. So I'm going to ask this first to Jeremy and then toss it to Joy. Just really quickly as we wrap up, we've seen as a result of COVID a number of hospitals and health systems that have been needing to have furloughs and layoffs in response to the reduction in non-emergent care as a result of the COVID-19 pandemic. Starting with you, Jeremy, what do you see as some of the shorter term ramifications for the clinical workforce? And then Joy, for the long-term ramifications, and all of this sort of wrapped up a little bit in the fact that there may be concerns, as we know folks delayed care going into the pandemic, there may be safety concerns about returning to the facilities and when those numbers of non-emergent, if you will, procedures come back. So again, Jeremy, from the short term, what do you see as the ramifications for the clinical workforce? And then we'll go to Joy.
Thank you. What I see for our clinicians in the short term is a significantly increased stress level. And I read a study recently that said in the first couple of months of the pandemic, so March, April, stress levels stayed relatively low. And as we, we're inundated with the sensationalism in the media, and as we were inundated with the fears of what was going on in this country, stress levels amongst our clinicians rose and continued to rise. And the unfortunate reality is what happened as we felt like we were coming out of the initial phase of the COVID-19 pandemic was that organizations had to look at their finances, and the fact that most of them lost significant income with the reduction of elective procedures. Those organizations had to look at their finances and had to make tough decisions on returning folks to work and on laying off lower level, less essential employees. And the unfortunate reality is what that does is it simply puts more pressure on our clinicians and puts more stress on our clinicians. And as we've seen, what we thought was us coming out of the pandemic has not really been us coming out. It was just a lull before what could be another potential significant storm. So I think the stress levels on our clinicians are probably the most significant concern as a result of the pandemic. The other thing that I have to mention is there used to be, and historically has always been, a cachet with working in healthcare. There was pride in healthcare. People understood and felt like having a career in healthcare was stable and it was going to be long term, and there was little that would affect their ability to practice their career. And I think what COVID-19 has exposed is that no industry is exempt from a negative impact. And the fact that we've seen folks furloughed and layoffs and cost reduction, I think really will have a long-term impact on the industry from the perspective of it was an industry that most folks felt like if I choose healthcare as a career, I'm going to be sort of exempt from the market swings and what the economy is doing. And I think this really has sort of put a kink in that armor, and people recognize that healthcare is also impacted by the larger economy, and healthcare institutions are making the same tough decisions as other businesses when it comes to the ability to weather a financial storm.
Thanks, Jeremy. Joy?
Well, as Jeremy highlighted, the pandemic has triggered quite a range of workforce challenges. And we know that for many in non-clinician roles who were furloughed, they are moving on to other opportunities. And there is growing recognition that the recovery period for hospitals and health systems will be a protracted one. And so along those lines, one of the considerations in front of us is whether we will see the potential downsizing or elimination of various departments to decrease expenses. At some point, consumers will decide to address their unmet healthcare needs. We're already beginning to observe that. The question for me is whether they will access care in a primary care setting, where I think there's a strong likelihood that we will see long-term reduction in access, because many freestanding primary care docs will simply not be able to recover from having shuttered during the pandemic. Or will we see the care occurring in more acute care settings like urgent care centers and emergency departments? So that's an outstanding question in my mind. We can also consider this along the dimensions of reallocation of staff, right? We spoke earlier that staff who traditionally worked in an ambulatory setting may have been cross-trained to work in the acute care setting. So there's that consideration. In addition, social distancing requirements that we've now come to accept will likely change the way clinical workflows are designed, and may in fact have the effect of decreasing the number of clinical staff in some departments. And so I think we just can't lose sight of all of these moving parts. Hospital administrators will need to consider alternative staffing strategies, such as a contingent workforce, and maybe restructuring volume-based physician and advanced practice provider contracts in order to better align with patient demand, and to the point that Jeremy made around maintaining the organization's financial viability. But I want to pile on to Jeremy's point about stress levels, because I think we would be remiss if we didn't touch a little bit more on workforce resiliency, because we want to encourage more care to be given to assist frontline workers to essentially process the grief and the moral distress and the magnitude of the loss that many of them saw and continue to see on a daily basis. And so leadership should be really creative in the ways that they set out to promote the well-being and the resiliency of their clinical frontline workers, because we know that the emotional fallout from this pandemic will linger. And so we are looking to our leaders to be attentive and to really practice leading with empathy. One of the AHA's board members has warned us, and maybe that may be putting it in strong terms, but he has shared with us that the crisis that will emerge from the remnants of COVID-19 will be a behavioral health one. And so it really our hospital and health system leaders to remain vigilant around this particular issue of workforce resiliency. And so I just wanted to make that additional point.
Absolutely. Thank you both. I couldn't underscore the resilience issue any more than you already have. It is very much a challenge that we were facing before and has only been amplified by this crisis. So thank you for joining us, and I look forward to further chats with my colleagues.